Good morning. I'm going to call to order this meeting of the Health, Environment, and Community Engagement Committee. I am Cam Gordon. I'm chair of the committee, and today I'm joined by council members Andrew Johnson, Jacob Fry, Elizabeth Glidden, and Lisa Bender. We're a quorum of the committee, so we can conduct the committee's business. Our agenda today includes one discussion item and 3 consent items. I'm going to move the 3 consent items first. I'll read those and then moving forward. And if any committee member would like to pull one off for discussion or questions, we can do that. The first one is authorizing an amendment to our contract with Tubman, increasing the contract by $100,000 for a revised contract total of $175,000 to provide case management services in 2015 for youth at risk for involvement with violence. The continuation of services in 2016 and 2017 is contingent upon the availability and amount of funding approved by the council and on agency performance. This will be referred to the Ways and Means. The second item is approving appointments to the Public Health Advisory Committee. These are appointments and reappointments. The mayor is bringing forward 4 names: Harrison Kellner, Akeisha Everett, Jahani Berry, and Sarah Jane Cavini. And actually, those are council appointments. Sorry about that. And also reappointments by the council of Happy Reynolds Cook, Karen Soderberg, Rebecca Thoman, a mayor appointment of Sylvia Perez, and a council appointment of Joseph Kalanani. And the third consent item is authorizing execution of a contract with the University of Minnesota for up to $50,000 for veterinarian services with animal care and control. Does anyone wish to pull any of those items for discussion? Seeing none, then I'll move all 3 items. All those in favor, please say aye.
Aye.
Any opposed, say no. That motion carries. And then we have our one discussion item today, which is a discussion about our school-based clinic program. It's really a presentation, and then we'll have time for questions and some discussion afterwards if the council would like. Good morning. Welcome.
Good morning, Councilman Gordon and City Council members. I'm pleased to be here today. I'm Barbara Kyle. I'm the manager of the Minneapolis School-Based Clinic Program, and we're really pleased to give you a general update of our program. We put together a PowerPoint, and some of you are new to learning about our program and others might be very familiar. I wanted to first mention off that we're at 7 locations throughout Minneapolis. We're located within the high schools. You can see the school emblems. So we're at Edison, Patrick Henry, Longfellow is the beautiful Cleopatra. We're at Roosevelt, South and Southwest in Washburn. And we've been in existence over 30 years. We provide a range of adolescent specialized services. Our scope of services is consistent with the needs of the people that we serve and best practices. So we provide acute care, injury care, we do wellness care, sports physicals, employment physicals, we do immunizations, we do family planning, treatment and diagnosis of sexually transmitted infections. We do nutrition education and counseling, and we do a lot of one-to-one health education, and we do mental health services, which includes crises, diagnostic, and ongoing treatment of a range of mental health illnesses. Last school year, we served about 2,300 students for about 12,000 visits. In addition to our one-to-one services, we presented over 300 times to classrooms and other events and reached 9,300 individuals. We focus on youth, and we have a multidisciplinary model. Our model really promotes working as a team. We're supporting the school and the community that we're in. Our goal is to make services very accessible, confidential, culturally sensitive, and developmentally appropriate to the teens that we serve in our high schools. And I thought it'd be helpful for you to see that our school-based program contribute to the advancement of several of the health department's goals that you're probably very familiar with: thriving youth and young adults, healthy weight and smoke-free living, and a strong public health infrastructure. I have busy slides, so to keep you looking at things. But I wanted to give you a little bit of background about the impact of school-based healthcare programs. We're really fortunate. It's kind of the convergent of public health, primary care, and mental health. And we're in an optimal setting, we believe, we're where the kids are to really promote positive health. There's been a variety of studies over the decades that show that school-based healthcare improves access. Often adolescents underutilize healthcare, or they face challenges that require more confidential or very sensitive, and so it's hard for them to maybe get those services in the community. We also know that our services help cost savings. There's multiple studies that show students that use school-based healthcare use the ER less frequently and more appropriately. We also prevent pregnancies and sexually transmitted infections, which are ways that we definitely do cost savings in the long run. We also are there to promote academic success. I think everyone knows that healthy students are much more apt to be healthy, able to learn. And so, there's been multiple studies that show that kids that use the school-based healthcare center have better attendance, and they also are more connected to school. 2 studies a couple years back showed that African-American male users were 3 times more likely to stay in school than their peers if they used a school-based healthcare center. Yes, and then I have a very busy slide. I know that you might be interested in a little bit about the young people we serve. I think the thing I want to point out, last year, these are our demographics. Our students are young, so you can see that 95% of our clients are between 14 and 17 years of age. We serve more females than males, although that male rate has gone up from about 25% a few years ago to up to about 35%. The types of visits that we see as a whole, the majority are sexual health at about 40% of our visits, mental health at about 35%, and physical health, which includes nutrition services and the range of visits I talked about earlier. I also wanted to note that we see a really diverse group of students. Our race and ethnicity really reflects the students in the buildings. And then I also wanted to point out what kind of insurance students have for the visits. 40% of our visits, students had public insurance programs, 9% had commercial, and then we had about 28% that either had no insurance or needed confidential because they were concerned about bills going to their home. And then we have a group that we call not eligible because it's on a grant-funded service that we're not billing the medical system. So this is another busy slide. Besides, in addition to our one-to-one care that we provide to students and the outreach that we do, we're involved in a variety of activities and projects that we know will help improve the lives of young people in our community. We've been working the last couple of years on a project called Project Connect. It's a national project that the Minnesota Coalition for Battered Women, along with some adolescent clinics in the metro, have been training and working in our clinics to do universal screening. So when students come in, we talk about healthy relationships with everyone, and we give out this little card, and we ask them, if they have any concerns, and we've worked out partnerships with some agencies that we can refer kids to, and we have them take the card and think about it and talk with their friends. Another initiative we've been involved with is I Am My Health, and it's been a county-wide, federally funded 5-year pregnancy prevention and STI prevention grant. And it's evaluating a promising strategy of using motivational interviewing to motivate kids to make good choices when they're sexually active, and using protection. Kids have found that intervention very helpful. We also are a member of the My Health project to really make clinics much more teen-friendly. Another initiative we've been involved with is a partnership with the schools and Target to get some of the younger middle school kids in for sports physicals so they could participate in sports at their schools. We've been involved with a program called Crush, and Crush is a community collaboration in the north side of Minneapolis, primarily to really look at what can we do to reduce this high rate of adolescent chlamydia. We've also been fortunate to be working with the Minnesota Campus Compact for the last 3 years to have AmeriCorps Vista, and we have our 3rd year Vista in the audience, and that's been very helpful for us to involve with more engagement in student activities to have a VISTA. We've also been involved with the CDC's PHAP program, and so we have, we're on our third 2-year member who's doing, again, work with the clinics to make us stronger and doing things that are not just one-to-one in the clinic, but doing kind of activities and programming that allows us to improve our quality. And again, I mentioned that we do a lot of outreach. We've been involved in the Silver campaigns at some of our high schools. That's a student advocacy around mental illness. We've also been doing a lot of outreach on special events. Like you can see in the corner, Get Yourself Tested Month. We do activities to educate young people. In the last 2 years, we have started our youth council, and we have a couple members of our council here today, and I'm going to have them talk about it, so I'll save any comments. I think another question I get asked a lot are, what do parents think? And we have been surveying parents for the last 10 years, and it's very positive overall. Parents have told us that they feel that the clinic is really important. It helps their students miss less school. It provides some of those emergency services, and also they recognize the need for privacy for their children. And then in our recent survey, 72% of those surveys said that they talk to their kids about the clinic services, and 2% of those encourage them to use the clinic. So I think overall parents are very happy to have that resource for their young people in our clinics. A couple of years ago, we started implementing student satisfaction surveys of those clients that used us, and we wanted to get feedback on how we were doing and ways to improve. And I just pulled some recent stats from our December 14 survey, and I think what we keep seeing is in this survey, it represents that 53% of those surveyed had been using the clinic multiple times that month or more than once a month. 97% of those students surveyed said they'd recommend it to a friend. And so with adolescents, that's probably the best litmus test of success, if they think it's good enough to tell a friend. They also felt overall very respected by the clinic staff. They felt comfortable asking questions, and they also said they were able to get in when they needed. And most of our kids are walk-in appointments. I also wrote down a couple quotes that they said, and I think these are really powerful, but also very representative of a lot of the feedback that we received. They said, I really appreciate and I'm grateful that the clinic is an available resource at school. I wish more students knew this was a safe space where you can talk about any problems you might have. In this clinic, I feel my privacy is respected and they treat me well. And so, we've also gotten some really good suggestions about ways that we might do things differently or trying to be more welcoming to all types of students. And so I think it's really important to get that student voice. Well, I'm going to introduce we have our Teen Youth Empowerment Council presenters that are here today, and they made a video, and they're going to tell you a little bit about the council and introduce the video. So who's going to be up first? Great. I'm going to let Gaia introduce herself and say a couple words.
Good morning. Thanks for being here.
Hi. So I'm Gaia. I'm from Edison. Every other Tuesday, I go to the group called the Council. And at the Council, we help advise and give input to the clinics on what they need to improve on and what they're doing good.
Hello, my name is Maya. I go to Washburn High School. And at the Teen Health Empowerment Council, we learn about health topics that are important to us so that we can share our information with our peers as peer educators.
I'm Emma Evers. I go to Southwest, and the council, through education and trainings, we develop leadership skills and making positive changes in teen health improvement. And now we have a video we'd like to show you.
Council. We're here to tell you about the school basic training.
And what I like about the
Hi, we are a part of the Teen Health Empowerment Council. We're here to tell you about the school basic training.
And what I like about the clinic at Southwest is it's staffed by a nice group of adults, and they know what they're doing, and they seem like they really care about the teenagers that go there.
My favorite thing about the clinic is the people that work here.
I like the clinic because it's free. You can get wherever you want by just you don't have to pay. It's free.
I like the clinic because they all are helpful.
I like the clinic because all the staff see you like you're a family and they help you out with everything.
I like that there are so many services that the clinics provides for us.
I like the school-based clinics because it's more convenient for the students since it's in school, not outside of school.
What I like about the school-based clinic is how inviting and safe the space feels when I enter.
The things I like about this clinic are how it's a no-cost place and how it's a safe place for sexual health for teens.
The clinic is nice because it's confidential and the only transportation you need is your 2 feet.
I like the school-based clinics because you get to stay in school and it's more convenient for you and your parents.
The school-based clinic helps with unwanted pregnancies and STI concerns.
I like this clinic because all the people who work here are really helpful.
I like how the clinic's a safe spot for teens.
The clinic is a great place to go if you have any concerns about anything health related, not just sexual health or anything like that.
All school-based clinics!
Woo!
Welcome to the school-based clinic at Southwest.
And this is where you can check in and make an appointment with our medical assistant.
Nurse practitioner Mindy.
Hi. Clinic nurse Marianne. Hi.
And this is where you can see our mental health therapist.
This is our lab where they take your vitals and they run tests.
You can also see a nutritionist and a health educator at the Southwest Clinic.
And she's the nurse for SSI. Hi. And then this is the mental health clinic with Nicole. And over here, if you want to get an appointment, school-based clinic waiting room. Hi, everyone. Here is the lab with our nurse practitioner, Julie. Hello. And then here's our office. And that's our tour. Thanks for watching.
Welcome to the school-based clinic at Washburn.
This is where you make an appointment or check in with our medical assistant, Janita.
Our nurse practitioner, Christy.
This is our mental health therapist, Jenny.
This is our health educator, Molly.
This is our lab where we want to run tests.
You can also see a nutritionist at the school-based clinic.
I'm Molly. I'm a student at Roosevelt High School, and I'm going to introduce you to our school-based clinic. So this is me. She will check you in when you come for an appointment. Back here, there is Allison. She is the health educator. Here's one of our mental health rooms. This whole area that we're in is the waiting area. Back here, we have the area where blood will be drawn for testing. Right here is the lab where all the testing gets done. Here is our nurse practitioner. So that was our Roosevelt School-based clinic. I hope you enjoyed.
Go school clinic.
Well, thank you very much. Closing comments?
The clinic is great for high school students because it doesn't take you out of school. You only need to walk down the hallway instead of leaving the school and going to an appointment.
The school-based clinics help students feel comfortable talking about their health and not worry about a cost or insurance.
The school-based clinic is really nice because all of the services are very confidential. And I also have some brochures to pass out if anyone is interested.
That'd be nice. Thank you. I appreciate that.
Thank you for bringing a virtual tour to our council members. As we would like to, in closing, invite you to visit any of our clinics. We're very proud of them, and you are welcome. So just give us a call if you're interested in coming.
Well, I appreciate that, and I was wondering what they actually look like. So getting that virtual tour was great, and it was very helpful, I think, for us to understand what goes on there. I think we might have some questions and comments and have a little discussion. So I see Councilmember Glidden has one.
Thanks. This is maybe a little bit more of a comment, but also I have a question in here too. I just want to say this was a really great presentation. I've been on the council for a bit, and I can't remember another time when there was a presentation on the school-based clinics. I mean, we talk about them, but, and I've been on other committees like the Youth Coordinating Board, where I probably have more knowledge than maybe some other council members about the school-based clinics, but this just helped really kind of put it in perspective. It's nice to actually see the places if you haven't gone into the school and visited that particular part of the school. And then I had no idea there was a student kind of committee that provides some oversight and recommendations, so it was really helpful to hear from you as well that there's that connection with the student body in the schools. I was curious about the mental health services because I know there's been sort of increased emphasis on the need for those sort of support services within schools and being more accessible to students. And so I was wondering if you could give us a little bit more about how long you've had that area within the school-based clinics of offering mental health services, how used those services are, and just a bit more of a picture about that.
Sure. Well, thank you, Councilwoman Glidden. I've been with the school-based clinic 5 years, and I've seen quite an evolution with mental health. I think we've kind of moved from more of a social work model to providing more ongoing care, because that's what kids need, and we know that they don't get it when they go somewhere else. They don't make it there. So we've been able to increase our mental health therapists. We have almost a full-time FT at every building, if not one. And we've been partnering with about 4 different graduate programs to have graduate students that work a full year with us. And so that really helps. We train them, we work with them, but by mid-year this time they have caseloads. And so that really allows us to see many more kids. We connect a lot with the Mental Health Collaborative in Hennepin County. That's a school-based model. And that's been allowing us to get a little bit more resources as well. We've been able to be more successful in billing. And we've involved the parents a lot more in the therapy and that helps us also with the billing as well. I think all of our sites, we have a pretty heavy caseload. I know that South last year, they had a waiting list. So it's an area that we did receive some extra city dollars for a halftime, and that's really wonderful. I think the demand is really quite great. Some of the barriers, language, culture, even just finding somebody who's really comfortable with adolescents, the range of mental health needs we see is quite great. And we have kids that have some psychoses, and people in the building didn't know that. And, we've been able to work with them. We have kids with, anxiety, depression, conduct disorder, a range of maybe just adapting as adolescents, dealing with traumas. So it's kind of a range, and we have very skilled, licensed family and marriage therapist, a psychologist, and also 2 MSWs. So it's nice to have a multidisciplinary mental health team as well. And I think the team has really evolved in more collaborating with other providers. Some schools, there are more than just the mental health services through the school-based clinic. And so we have teamed and triaged, and sometimes we'll take the families that have less resources because they can't get into private. So if you would like to know more, we'd be glad to share. I feel like our program in mental health has really evolved, and it's really a big cornerstone of our clinic.
Thank you for that. I feel like it is a very critical part of the services offered to students, and thank you for that and for the overview.
Good.
Thank you. Councilmember Frye.
Thank you, Mr. Chair. To echo Councilmember Glidden's statements, excellent presentation. They say a picture is worth 1,000 words, so a video is worth like 10 or 15,000 at least. Couple of specific questions, and I apologize, I have a bit of a frog in my throat. But How do you handle condom distribution in these centers? And then the second, how do you handle women's choice issues? So I'm curious.
Well, first of all, the clinic is separate from the school. We have our own policies. We're a HIPAA-covered healthcare organization, so we make up our own policies and procedures. We distribute condoms to clients that are part of the clinic. We also do events where people might just get to know us, and we are looking at our policy to be more outgiving. I think a lot of the research is showing that it's really important that kids have them, but it's also important that they have demonstrations. And so we, with this SSI grant, Safer Sex Initiative, we've really been able to promote safe condom use. And so we want to be able to give them to kids, but we also want them sometimes to come in and talk a little bit more, or we can give a demonstration. So I feel that we definitely give condoms because it's best practice. Your second question was?
To follow up on my first question, yeah, I guess I was asking you, have you found that it is more advantageous to have, condoms in a big bowl right in the front where people can just come by, grab a handful and ditch? Or, in order to get the condom, you have to understand how to use it and make sure that it's safe? I honestly don't know the answer.
I think that's a really good question, because actually we have a committee and our CDC associates helping lead that, looking at practices, because we haven't done the big bowls. We're within a school, so we have to be, right, I think, considerate, and we've changed a lot. So we have had the brown bag. And so a student can come in and we, if they've been seen in the clinic, we give them a brown bag with a little information and some condoms. And so I think we're looking at that. I don't know if we'll do the bowl. Maybe we will. I think we want to evaluate, what will fit best in that school environment, but also what's really the best for young people. And so maybe there's a way that we can do a combination.
Okay. And then the second question is more sort of women's health and choice issues. I guess I was mainly asking about abortion, how you handle that in sort of the school atmosphere, and how you counsel towards a direction.
I think that we do all options counseling with kids, and we have really strong relationships. And so if they are looking at one option or another, we provide them those resources. We have connections and phone numbers, and we would try to find some adult in their life primarily that they could get some support, because it's really important. And so we definitely provide all options counseling. And we try to not get to that point by preventing it, but when we do have a kid who does come in with a pregnancy, we work with them individually.
Thank you for your great work.
Yeah, thank you so much.
Well, thank you very much. And I also have a couple questions. One of the slides you showed us had the staff. There was a teen in the center, and there was the wheel that included a medical director and a nurse practitioner, and many other positions. And then when we took the tours, it wasn't, it looked like there was a nurse practitioner at one of the schools and maybe not the other. So I'm just curious, does every one of the clinics have a medical director, a nurse practitioner, and a registered nurse and all that staff, or how does that work?
Councilman Gordon, it varies a little bit, but overall, every clinic has a full-time nurse practitioner. 2 sites we share a nurse practitioner, and then there's an RN. And so maybe when they filmed the video, the nurse practitioner wasn't there, so we've moved from an RN kind of model to much more of a nurse practitioner along with a medical assistant. So we have that at each of the 6 locations. At Longfellow, the School for Pregnant and Parenting Students, we're there 1 day a week with a nurse practitioner. And then we have a health educator doing work 3 days. So it's a little bit different at Longfellow, as they've a smaller school and they more recently reopened.
Well, and that wasn't my other question. What about the hours? Are the clinics open whenever school is open, or are there limited hours? And it sounds like it varies from school to school, but maybe you could just give us a sense.
Sure, Councilman Gordon. We're open definitely when school is in place. So we're open before school typically, and after school. Some students prefer to come at 3:30, some come before school starts. On release days, we are open some days, and in the summer we have multiple clinics opening. And so some of our clients will schedule in advance that need to come, and then otherwise for sports physicals, we'll designate that we have a couple clinics going. And so we have limited clinics in the summer, but we always have a way that students can get in, and we have electronic medical record now, so we can do scheduling at one location from another location, which is very helpful.
And I'm also curious about how long we've been at Longfellow, and just to be clear, now that we're at Longfellow and Southwest, we're at all the Minneapolis Public High Schools, correct?
Yes, Councilman Gordon and committee members, there are 6 regular high schools in Minneapolis, 7 high schools in Minneapolis, and we are at all of those except North High. And North Point has always operated the clinic at North High, and we work closely with them, share different resources, and then we have always, probably since 2000, we've been with the teen parent program at Broadway, and then it went to Longfellow. And in between, it went to North, and then they operated the clinic. And when it went to Longfellow, we had opened up South again because it had been operated by Children's, and they closed. And so we reshuffled our resources. So now we are at all the high schools in Minneapolis, except North is at North. North Point is at North, and we're also at Longfellow part-time.
Okay, and I'm also curious about the budget. I know in the past we've had some discussions, and we've tried to drill down and see what money we could save if we just, I mean, believe it or not, committee members, there have been council members in the past that thought about closing these. I know that we work hard to get insurance to help us cover some of the costs, but can you just give us an idea of how big a city investment this is maybe, or?
Sure, and Councilman Gordon, I did have a slide, and I thought, well, we're more informational, I won't do the finance, but I think so I'm going to give you a general sense that probably about 10% of our funding is from Fund 1 from the city, and then probably about 30% is from patient revenue, so we have increased our patient revenue. Every year we've almost increased it in the last 7 years, so we've gone up quite a bit of patient revenue. We also use some of our public health dollars, our local public health and our maternal child health grants, and then we have some other smaller grants. So really the bulk of our funding is public health grants that come to the city health department. Want to add anything?
I suspect that that budget slide would have been appreciated. So just for future reference, getting that kind of information, and it tends to be the kind of thing council members start thinking about, is like, where does the revenue come from? How much does this cost? And those kinds of issues. And I'm assuming that we get the space free from the school district, but the school district doesn't actually subsidize any of our expenses?
Councilmember Gordon, yes, we have a lease. We have a 10-year lease that our attorney helped us forge. And so we have space within the school at no cost, and they provide telephone, data drops, cleaning services. And in fact, 3 years ago, we got a federal grant to remodel. And so the clinics are looking very fancy. We have more private rooms, we have doors, we have files that lock, we don't have shower curtains for doors anymore. So we've been able to do some enhancements off of a federal capital grant that looked at improving school-based healthcare centers across the country. We've gotten additional space from the schools because they see us as really valuable. So South, which is a very busy school, gave us 2 extra offices, and Henry last year gave us another office so we could have a full-time mental health intern. So I think that's hard because they have other people competing for that same space in the building. So we've been very grateful to get quality space within the building, and it's grown in the last couple of years.
Well, that's wonderful, and I think that having a good relationship with the school and with the district is really important for these to be successful, and that's kind of my last question. Do we provide any consultation or services to the school staff and personnel, or any workshops? It seems to me there might be some really great opportunities to talk to a career counselor or a particular teacher. I know that everything has to be confidential, and I really also appreciate how the clinics are separate from the schools. But maybe you could talk a little bit about that relationship, or if there are some services and things that we give back to the staff and to the district.
Well, thank you, Councilman Gordon. That's a very good question. I feel we partner on quite a different, and we provide information in a couple different ways with the schools. So we work very closely with the health office, where the school nurse is, which often isn't too close to us. So we do a lot of triaging, a lot of partnering. We do some education for the school nurses when we're asked. We are a part of the social worker, the school support team in most of the buildings. Some of our schools, we have done a lot of work around how we can share information, what kinds of resources we can be to each other. We've done some training when asked. So we have very close relationships with multiple people. I think in some of the classrooms, our health educators and other providers have developed relationships and do provide informal consulting, or they are asked to come and do a presentation on a topic that they feel that we might have a different point of view than a classroom teacher. So I think a lot of it's informal. Sometimes it is more formal, but we have very strong relationships in the buildings and district-wide as well.
Great, wonderful. Then there's a couple other questions too. I think Councilmember Johnson was next.
Thank you, Mr. Chair. I'm just wondering if there's something you're not doing now that you'd like to be doing, or are there any opportunities or challenges or kind of next steps or big things you're looking at with it, with the program?
Thank you, Councilman, for that question. I think actually we're doing some strategic planning to kind of look at, where we've been and where we are and where we're going. And I think, getting student engagement's been really critical for us and having a student voice, and we want to keep that going. And we've been doing our little grants, and so we might have to adjust pieces. I think the health education component has really grown, and I think it's really valuable. And so we want to be able to keep that in our model. So I think we are looking at, how can we do and what's most critical, what makes the biggest impact. I think this violence prevention one-to-one education has been really helpful in the surveys that they've done. Students think it's very valuable that somebody talks to them about things that most people don't ever ask in a way that they feel that's meaningful. And so I think there are lots of things we'd like to do, or we just really also want to continue some of the quality pieces that have come along around student engagement and health education. And I think mental health is really critical. Seems like we never have enough, so we have to prioritize and try to partner and do things the most efficient ways. So I don't know if that answers your question.
I think the strategic planning piece especially kind of gets at that taking a broader look at some of the other things you can do, but I really appreciate that. Thank you.
Thank you.
Councilmember Bender?
Thank you, Mr. Chair. I was curious as well, thinking about future opportunities to potentially expand beyond high school, and if there had been discussion of that in the past. And then I was particularly interested to know if, obviously it's a matter of resources, if the resources that we get externally are particularly focused on high school, or if there's opportunity for, I could think of extending it downward into junior high, middle school ages, or even, which is probably a much bigger thing to bite off, targeting kids in the pre-K timeframe. So it seems like there might be additional opportunities in the future, and I wondered if there had been discussions about that.
Thank you, Council Member Bender. I think that's a really good question. Nationally, school-based healthcare models are often in elementary or middle schools, and so they're not all. In Minneapolis, historically, we focus on adolescents as an underserved group that needs kind of unique approaches. I don't know if we've talked about middle schools here and there. I think we've also looked at, as the Minneapolis high school population has more choices and kids have left the Minneapolis public schools to other places, are we missing kids? What about the kids that drop out? We also work closely with some of the teen clinics in our community. And so we're not trying to be a community clinic. We are really building within a school and the relationships and with our community partners. So I think those are things that we ask and talk about, and especially probably kids we're not reaching. And I think our strategic planning, hopefully we'll have some good discussions and keep looking at that and take a step back, because sometimes you don't when you're in the middle of it.
I think that's an interesting question, and I've often wondered that too, now that we have a place in almost all the high schools, although North has someone else there. Councilmember Frye, did you have an additional question, or is that Jacob? You didn't have another question, did you? Okay. Thanks. Sometimes we use the first name just to get their attention. Well, I don't see any other questions. Thank you very much, and thank you for coming and the input. I was a little bit curious when you said we give ideas about how to improve the clinics, maybe what ways you might have to improve the clinics, if anybody has anything they want to suggest. Otherwise, it's not a big deal. Maybe you
have to come up to the microphone, Aria. Aria, tell your name and who you are.
Hi, I'm Aria Nelson. I'm the AmeriCorps Vista. And I also help with facilitating the council. Something that we've recently done is have the council members act as kind of like a secret shopper model and go into the clinic and give us their input on the services and the clinic's appearance and things like that. So that is something that we're just kind of wrapping up, and that the council members did a great job helping us give their input on what they like about the clinics, what things could be improved and not. So we're working on how to give that feedback back to the clinic staff and how we can improve. So.
Wonderful. Well, thank you very much.
Well, thank you. We really appreciate the opportunity to talk about the school-based clinic program, and thank you for your wonderful questions.
Well, thank you for the great presentation and the video and hearing from some of the clients of the clinic. It was really helpful. I don't see any other questions or comments, so I will move to receive and file that presentation and report. All those in favor say aye.
Aye.
Any opposed? That carries, and I think that's our last piece of business today, so this meeting is adjourned. Nicely done.